Renal Hawkins, the Chief Executive Officer of the Lifesaving Society Quebec branch. We have Eric Hervieux, who is our new commissioner of the National Standard Commission of the Lifesaving Society of Canada. And we have also Simon Ruffley, who is a mentor for the society for a few years. And we will address you what the adaptation do you need to promote and to implement in your facility during the COVID-19 situation. So I will let Renaud address you about our mission.
Welcome everyone. For us at the Lifesaving Society, our mission is never been so close to the reality. Promote safe interaction with water to prevent drowning and the other trauma is very important for us. Our Quebec Drowning Report can demonstrate it is very important to open or reopen the swimming facilities because the patrons or the bathers need a place to do their swimming activities or their bathing activities. And this is why it's more appropriate to go inside the swimming facilities when we have lifeguard on duty. Because if we want to compare the drowning data from the swimming facilities versus the open water, like rivers 40%, lakes 30%, and the backyard pool close to the 15%, as you can know now, is very important to going where we have lifeguard on duty. Please stay with us for the next half an hour to follow our webinar. And thank you everyone to be with us today. And I will also gonna have a very nice summer, everyone. Thank you and have a nice webinar.
Thank you, Renaud. In this webinar, the information that we will present to you is the results of a large consensus from, it began with a review of the scientific literature and the best practice that have been developed worldwide and in Canada. We look at what is happening in other countries and what are the measures that they put in place. And with the Canadian Lifesaving Society, the Program Commission and the Standard Commission, we and Eric will be presented those the results of those research. We issue 4 information bulletin that present and regroup all the information that we have on the COVID-19 situation regarding aquatic management. And it's been also a consultation with the Ministry of Health, the Environmental Health, and the Quebec Pre-Hospital Care agencies. You will see the protocol that we will show on resuscitation have been the protocol from those agencies. So there's a specificity regarding drownings, drowning resuscitation. And also we have our partner of Workplace Health and Safety, APSAM, that work with us on the measure that should apply to regarding lifeguarding, because we have concern about the safety of bathers, but we have concern about the safety of all lifeguards during the pandemic. So we work with the occupational health group task of the Institut National de la Santé Publique to review and validate the protocol that we will be presented and the protocol that have been used, for example, in the research. So we are sure that it's the best practice that we could have for lifeguards in the context of the COVID-19 situation. In this webinar, we will present the context of the COVID-19 with the Lifesaving Society and the services that we are able to offer during the situation. We will present in also the newsletter of the society, the potential mode of transmission, because it's important to know how you can prevent the transmission of COVID-19 in your facility. How do you prepare to the pandemic? Welcoming group of children, preventive measure. We'll see also how to organize the lifeguarding around the swimming pool and how to plan the first aid. For example, what kinds of PPE do you need for to protect your lifeguard and rescuer around the swimming pool? And do not hesitate if you have any question. Use at the bottom of your screen your Q&A. Everyone will have to access to the answers that we will provide, and we will also post all the Q&A on our website in the the affiliate member platform. We are working at the society at distance since the beginning of the pandemic. We are planning now to return to our Montreal office. We have, for next week, we will be about 50% of our staff at the Montreal office. All the other colleagues will vote remotely, and we are all at 75% of our time. So it may have some delays when you have any question, but be sure that we will take time to respond all the question that you will need, or for the service, for the if you need books, you can go to our website or call us. We will provide you those services. There is pending course, and it's possible to organize these courses in your facility right now till the beginning of the week. So it's possible to plan to retake national course and bronze course. Every certification that lead to national lifeguard may happen in the indoor swimming pool and in outdoor swimming pool. There is also an extension award of 45 days that will end for outdoor pool till the July 30th, because the outdoor pool are open till May 30. So there is a 45 days that you can get to plan your research and to get research. So it's possible for your staff to work even if their NLS is expire at this time. If you have any question, use our alert email. Next. What are the mode of transmission of COVID-19 in bathing area? Mainly, it's the SARS-CoV-2 virus is transmit to droplets. So when you talk, you emit kind of droplet when you sneeze. So the droplet can be in a facility, in aquatic facility. It could goes in the water, on equipment, and there's some minor risk of transmission on the surface. The main risk is from person to person. In water, there's a very low risk of transmission because of the chlorine. So you can keep your facility and operation at the standard that is actually, and there's no worries for that. So even in waterfront, there's no risk because of the amount of the water. So the main risk is to person. So you need to have distance of 2 meters in between those persons. I will let now Eric present the information bulletin.
Thank you, Francois. Hi, everybody. Thank you for attending the Life-Saving Society webinar, and I hope your family, friends, and yourself are doing well. It's a pleasure to be with you today. As mentioned, my name is Eric. Let me begin by presenting the work that was done by the Safety Standard Commission to help the affiliates in reopening their aquatic facilities. So next, yeah, thank you. Here on this tab, you have the link to the LifeSaving's website. There are 4 sections available. You have general standard, swimming pool standards, and waterfront standards. Those 3 first were already available before the pandemic. So if you go through them, you're gonna find many standards that are available, and those are really helpful resources for you. More specifically, under the 4th one, the COVID-19 tab, you're gonna find the newest information that is now available for you. Next slide, please. So just before we go a bit further, a reminder, we have obligations and there are some strategies. We're gonna try today to make it obvious when we are talking about obligations that you have, rather than when we're talking about strategies. A lot of the content that we have been preparing in the last weeks are strategies to help owners and operators to restart their facilities. So those need to be adapted with your facility specifics, and that's it. Thank you. So about our information bulletins that are now available, there is many information out there. We are talking about minimizing the risk in case of an intervention. This is really important, and these are mostly mandatory information that are presented in this information bulletin. Also, we have precision about cleaning and disinfecting public spaces, water quality management, staff PPEs, and guideline for staff training when we are doing ongoing in-service training, when we are doing certification, recertification, and formation of new members. Also, on the website of the LifeSaving, you will see a guideline for reopening aquatic facilities. Under the slide, you see all the topics that are being presented in that guidelines. As you can see, many subjects are presented. As I mentioned before, in this guide, we are mostly presenting tips to help owners and operators to address many of the upcoming issues. These are really easy to adapt to your aquatic facility. Also, another important resource for you is the guide that was prepared by the Quebec Association of Aquatic Managers. I strongly recommend you to consult this guide. There have been many updates of this guide since information is always coming up, and there are new instructions that we are receiving by the health officers. This guideline has been updated almost every day when new information came out. Among the common questions in site adaptation you'll have to think about is the maximum bather loads. We received a lot of questions about it. How can I maintain physical distancing while swimming? How much bathers can I allow in my facility? Since physical distancing is the most important factor to reduce COVID transmission, every owner and operator must answer those questions. So we've been looking what is being done both in Canada or internationally. What we are seeing is there are many approaches. Here in Quebec, we do not have any number that is mandatory. So we are presenting recommendation, and every owner and operator has to adapt it to his site. The common numbers that we are seeing goes from 7 square meters to 10 square meters of water. Next slide, please. So we have been preparing some tools and guidelines to present to you today. The approach that we use is an hands-on approach, and we have to remember that swimming is a dynamic activity, so we cannot just allow ourselves a 2 square meter space. When we will be doing aquatic activities, we will need much more space to make sure that physical distancing is maintained. So let's start with lap swimming. For lap swimming or long distance swimming, we recommend to have only members of the same household to swim in one lane. So this is the most common guideline that we are finding out there. This means that usually there will be only one swimmer per lane, unless there are other members of the family that come together to train at the same time. So what do we do if we have more than 6 people that want to train at the same time? In Quebec, the Association of Aquatic Managers is recommending to have one swimmer for every 10 square meters of water when we're doing lane or lap swimming. And this works when we are swimming in circle. So this concept of swimming in circle means that the bather, let's say the swimmer is in the first lane, he will be swimming to the deep end in the first lane, and it's going to be coming back to the shallow end through the second lane. So this is what we call swimming in circle. Doing so, we are allowed to have more swimmers per 2 lanes. So it works for 2 lanes together. Swim Canada is using the same principle, swimming in circle. A precision about Swim Canada's guideline. Since last Friday, they recommend to have 6 swimmers per 2 lanes. So this number is slightly different than what the Association of Aquatic Managers is recommending in Quebec. I'm giving you the information because some of you have athletes training in your facility. So until last Friday, it was 4 swimmers per 2 lanes, and now Swim Canada has adjusted this number, and they're talking about 6 swimmers per 2 lanes. The Lifesaving and the Association of Aquatic Managers is recommending the 10 square meters per bather when doing the 2-lane swimming in circle. Also, we have the public swimming, the recreational swimming. The recommendation that we are making to you today is a 7 square meter per bather. So this comes also from the Quebec Association of Aquatic Managers and the Life-Saving Society to work until now. In other countries, we've seen up to 1 patron for every 10 square meters and as low as 1 patron for 4 square meters. It's important to note that in countries using the 2 meters physical distancing principle, like we do in Canada, our guideline seems to be between 7 to 10 square meters per patron. In some countries, they are recommending a physical distancing of only 1 meter, like in France, or 1.5 meters, like in Belgium and Germany. So those have lower ratios of 4 to 6 square meters per patron. So this is why there are some difference out there and why we are going for the 7 square meters rather than any other number that is lower that you might have heard until now. This means that there will be many people at the pool, not many people that will be able to attend to the pool. So in order to avoid lineup and accept as many patrons as possible, some aquatic facilities have decided to prolong opening hours to allow patrons to refresh in the water and use the facility for a fixed duration of time, let's say between 45 to 90 minutes. And some are also implementing an online reservation system. Finally, we've seen some aquatic facilities that decide to prioritize day camps on certain days and giving hours. Thank you. So, welcoming bathers, of course, you will need to put in place a system where you can screen the patrons that come to your aquatic facility, as we are seeing right now in most grocery stores. So if a patron has some symptom, he must be refused access to the aquatic facility and be referred to the health services so he can find some help and be taken care of. Also, it's important that your staff follow the same rules that are being shared here. This is probably going to bring many PR situation with your staff, so they're probably going to need some help from you and some staff training specific to PR situation, since those are, won't be used to deal with them. And also, we have to take in fact that patrons will not have the same concern about COVID-19. Some people think they can catch it while speaking on the phone, while others think it's an invention from the government. So you really need to train your staff and assist them in those new rules that we are implementing. You might need to think also about managing day camps and groups and how you're going to be doing swimming tests. So here we have some pictures of what is being done in France. This pool is already operating, so we can see the circulation arrows that have been placed everywhere, and the amenities that are closed or open to allow physical distancing between each users. So I don't know, Guylaine, if you have any question that you want us to answer at this point, or if I pass it along to Simon right away.
It's a Simon turn.
Okay, so Simon, you can go ahead. And if you have any question, don't be shy, share them in the Q&A, and we will be answering them at the end of the presentation.
Good afternoon, everyone. We're going to keep going with some disinfecting protocols. So when it comes to lending equipment to bathers, the general rule would be to try and avoid lending those equipments. So whether it's balls or buckets or noodles or training equipments as well, like flutter boards, just because there is a risk of surface contamination by users. In addition, some of these items have very porous surfaces, and it makes them particularly difficult to clean. So with an agreement with the pool management, it would be possible to invite people to bring their own flotation devices, their own balls to use in this pool. If it's not possible, then a disinfection protocol needs to be put in place for the equipment that is being used. And that includes something as simple as chairs that people will be sitting in. They need to be cleaned between users. Certain equipment, such as PFDs, needs to be available for safety reasons, especially when you're welcoming day camps or other groups of children with various levels of swimming ability. So we have a cleaning protocol for PFDs. Because of the nature of the PFD, it is a pretty porous surface. So at a pool, you would need to immerse the PFD in the chlorinated water for 15 minutes on each side. So 15 minutes on one side, 15 minutes on the other side, and then put it somewhere where it can dry quickly. And then once the PFD is dry, it can be loaned out to another patron. If you're talking about a waterfront, then it would be a bleach solution that you would need to bring at about 6 droplets of bleach in the solution. For the safety equipment, we'll start with the lifeguarding equipment. Need to be cleaned between each lifeguard use. So for the lifeguard chairs, before any lifeguard goes up, it needs to be cleaned. And then after the lifeguards as well. For the rescue aids, ideally what would work best is if each lifeguard has their own rescue aid that's assigned to them for the duration of their shift, and then they are disinfected after. If that's not a possibility, they need to be disinfected between each handoff between lifeguards. It's important to remember, can you just go back, Guylaine, for a second? Thanks. It's important to remember that the COVID-19 virus is eliminated by most regular cleaning products. So as long as you're following the manufacturer's recommendations of how long to sometimes leave a cleaning surface on an item, for example, that the cleaning products will be doing a good job and be taking care of disinfecting. So for welcoming groups of children, such as day camps, it's important to remember the social distance of 2 meters. You might have heard recently in the news that for children 16 and under, that the distance has been reduced to 1 meter. However, in aquatic environments, the recommendation of 2 meters does remain. So 2 meters at any age group in and out of the water. As Eric mentioned before, there's multiple strategies to reduce capacity, and it'll be up to individual facilities to work that out. Whether it involves making reservation systems as well to avoid lines, the ground markings that we saw in the picture from France. You need to think about access to toilets. It needs to be available for emergencies, but obviously it would be nice to encourage people to see to these needs before arriving. It's also important to encourage people to change into their bathing suits before arriving, and that's to limit the need for locker rooms, so especially for these groups of children. Measures, we still recommend an assessment of swimming skills, teaching children about the particularities of your environment, so the water depth, where the drop-off is, where it's deep, where it's safe to be depending on their swimming ability. We still recommend that PFDs be made available to them. It's just important to follow the disinfecting protocol. If people have their own PFDs, they could be encouraged to bring them. It will save a little bit on the disinfecting. The day camp counselors, the monitors, the guardians, depending on what kind of group of children, also need to be informed about the safety measures that are going to be in place. And for outdoor pools, it's important to recommend that sunscreen be applied 30 minutes before going in the water so it doesn't get washed off. And on site, they can take a soap-free shower to rinse off dirt, but without getting rid of the sunscreen. For welcoming families, again, the physical distancing of 2 meters will apply. We're still reducing capacity. We're still looking at reservation systems. Ground markings will still be effective. One-way lanes, so we talked about putting 2 lanes together, so they're one direction, one way, and the other lane would be where they swim back to their starting point. The other alternative is family zones of families all want to share a lane that is workable. And the same thing in shallow water for when you're not doing lap swimming. You can have dedicated family zones where families can interact at a closer distance. The hygiene measures, Eric talked about the questionnaire. If they do present from symptoms on those questionnaires, they need to wait at least 24 hours before coming to your facility. Hand washing is going to be very important, to have soap and water or alcohol-based disinfectant available for people as they enter. For face protection, it's important that people who are wearing masks to enter do not wear them in the water. A wet mask could cause problems breathing. People should follow respiratory etiquette in the water as they do in everyday life. That's if they have to cough or sneeze, they do it into their elbow or into a tissue that they dispose of right away. It would be very important to have all of the hygiene rules posted in common areas that are easily seen by all bathers as they enter, and then reminders as well around the pool. Again, access to showers and toilets is going to need to be controlled, and as they're used, they'll need to be disinfected regularly. For the lifeguarding and life-saving, lifeguards, particularly in outdoors, are going to be wearing polarized sunglasses. We do talk a lot about eye protection, as we'll go forward into the first aid, most sunglasses would not be considered eye protection. So we'd be looking at actual safety glasses or a visor to act as that eye protection. The lifeguard should also be maintaining their physical distance, so 2 meters from other lifeguards and patrons, but they still need to be able to be in a position where they can see the entire bottom of the basin in a constant manner, covering their entire zone. They should be washing their hands before each rotation and disinfecting the chair, common surfaces such as the chair itself and the ladders before they take their position. After the chair's been disinfected, they should wash their hands. So whoever is disinfecting the chair should wash their hands after. The masks aren't necessary while you're lifeguarding, while you're on the chair, and for any interventions where you're able to stay 2 meters away from the victim. On the first aid side, so the first aid kit needs to include extra PPE and make sure you have sufficient quantities. You should have an alcohol-based gel for easy disinfecting of hands, pocket mask with an antiviral filter, eye protection, as I mentioned, that's safety glasses or a visor, a procedural mask, a surgical mask. It has to be a surgical mask. It can't be a homemade face covering, and gloves. For training situations, we recommend that training for first aid as much as possible for first aid and life-saving to use mannequins where appropriate. And instructors, lifeguard and life-saving instructors have been through a training themselves to know when use of mannequins would be appropriate. And the use of lifeguarding aids, which allows distance between the lifeguard and the rescuer, such as the reaching poles, the rescue tube, or rescue can, which both provide a 2-meter rope attached to them, all help maintain this distance. So the PFD, for example, which is commonly used as a rescue tube, rescue aid, would not allow for the 2-meter distance. So we're going to favor the other aids during COVID. Next, please. So your lifeguards who have attended our webinars have seen these slides as well. So for a drowning victim, again, we're going to try as much as possible to maintain 2 meters distance while bringing the victim back. So that's using a pole, rescue tube, or rescue can. If it's not effective, then they will still be able to do a contact rescue, trying to keep as much distance as possible between them and the victim's face. Out of the water, they'll try and do their observations and their treatments from a distance. If it's ever necessary to go inside a first aid room, they need to put on all the PPE. So they would need to have their procedure mask, eye protection, gloves, if they're going to be getting that close to the victim. It's important to note as well that the lifeguards need to be dry before they put on a procedure mask, so they'll need access for something to dry. So it could be favorable that the lifeguard who did the water intervention is not the lifeguard who necessarily will do the first aid follow-up. If someone is already dry, they can have their mask on and take the lead on the intervention out of the water. For a non-breathing victim, so someone who's unconscious, the procedure won't be too different from what it normally is. Again, use of rescue aids to help facilitate a bit of distance during the carry and tow would be ideal. The backup lifeguard who's meeting them at the side of the pool for the removal should already be in PPE. They should have on their procedure mask, eye protection, and gloves. And they'll be able to remove the victim from the water. At that point, CPR may begin. CPR we'll see on the next slide if we move there. If CPR needs to begin, there's a few different recommendations. So public health recognizes that for drowning victims, they've suffered a respiratory arrest. So the ventilation part of CPR is very important. So the recommendation would be to continue doing CPR with ventilation. So one lifeguard would be performing the chest compressions in full PPE with mask, eye protection, gloves, and ideally a surgical gown as well. And the other lifeguard would be taking care of the pocket mask. So they would be holding the mask tightly sealed against the face the whole time. So while they're giving breath as well as while the other lifeguard is compressing, and that's going to maintain the seal around the mouth at all times. That lifeguard will be in gloves and protective glasses, eyewear, but obviously as they're giving breath will not be able to wear a procedure mask. If there's only one lifeguard available, then we suggest that we use the elastic band from the pocket mask, and you can see that on the picture on the left. So that's holding the mask in place while the lifeguard is compressing. The picture on the right is where a lifeguard can position themselves out of the way if they're splitting the job, one person compressing, one person giving breath. We do recommend if they are two and the person doing compressions is getting tired that someone replaces that person, but ideally the person giving breath will remain the same throughout the intervention to avoid having to change masks. Another possibility as well, if we just go back again for a minute, Guylaine, is if you have a family member who is trained and feels comfortable to help, they can take over the breath part, as that is where the most risk is. For times when it's not a drowning situation, for an adult, we're recommending, as it's a cardiac arrest, that we do chest compressions only with the use of the AED, and we should put a cloth covering over the victim's face. For children, the chances are, again, that it's a respiratory arrest, a respiratory problem that led them to need CPR, in which case we will continue as usual with CPR with ventilations. And we'll skip again one more. Some general first aid protocols. It's important that the lifeguards are ensuring their own safety as well as the safety of the people around them. So their co-workers, the victim, and other bystanders and witnesses that are present. So whenever possible, we keep a minimum of 2 meters distance from the victim. It could mean that we're promoting self-care. So someone could be handed a disinfecting wipe and a Band-Aid and be asked to take care of cleaning their wound and putting the Band-Aid on themselves. It's possible that we can ask someone from the same household who's already been in close contact with them to take care of that as well. If the intervention requires you to be within 2 meters, then it's important that we ask the lifeguards to put on the appropriate PPE to be that close, and that would be the procedural mask, protective glasses, gloves, and a gown. If the gown is not able to be put on, then it's recommended that the lifeguards have it changed in uniform and change the uniform and, if possible, shower before going back. That would be shower, then change their uniform before going back on duty. Victims who are being treated are encouraged to wear a procedural mask if they tolerate it. So a lot of children have difficulty with the mask and are not able to keep their hands off of it. So in this case, it wouldn't be a good idea, as well as obviously any victims who are experiencing respiratory difficulties. We don't want to impede their breathing anymore and worsen the situation. After the life-saving intervention, PPE that was used needs to either be disposed of or sanitized. So single-use items like the procedural mask, gloves, and gowns are disposed of properly, and protective glasses or visors need to be sanitized. And when everything is disposed of or sanitized, the hands need to be washed. We can move on. These are reminder posters that are available that you could put up in your first aid areas to remind lifeguards how to properly remove a pair of gloves without contaminating their hands, and how to put on masks as well. It's important to note that to properly put on and remove a mask, it involves washing your hands 3 times. Before putting on the mask, your hands should be washed. Before putting your hands to your face to remove the mask, your hands should be washed. And once taking the mask off, your hands should be washed. A mask should always be changed if it ever becomes dirty, if it becomes humid or uncomfortable. Next slide. This is just another example of posters that you can have around the facility as reminders to your lifeguards showing various types of PPE and how to get them on and off. So emergency equipment that will be required to have with your first aid kit, and often it's recommended that it could be in a bag separate to the first aid kit, so it's very easily accessible but attached to it. So you need your procedure masks, and you'll need a sufficient quantity of procedure masks. That's probably the piece of equipment that you might go through the most. Eye protection in the form of safety glasses or a visor. Pocket masks that have antiviral rated filters. Disinfecting alcohol-based solution for the hands. Make sure that your pocket mask has the elasticated strap to be used if needed, and the protective gowns, which are optional, but it makes life a little bit easier to avoid having to change clothes. In terms of rescue equipment, the reaching poles, the shepherd's hooks, need to be available, as well as buoys that have the 2 meters of rope attached to them, such as the ring buoys, rescue tubes, or the torpedoes, the rescue cans. During the context of COVID, we will be avoiding the PFDs as a rescue aid. Next, please. Oh, I'll hand it over back to Francois, who will continue with the harassment policy. Are there questions, Francois,
yeah,
before we proceed?
there's a question regarding spinals, because they have concern about how do we perform or train for spinals in the COVID-19 context.
So in terms of training for spinals, one of the adaptations we're doing is we're going to be using a mannequin that has neutral flotation to be able to do the turnover part. And after that, we will have people very carefully put on a mask and slip into shallow water and practice the boarding procedure with a mask on. In this case, it's in a controlled situation, and the mask won't be getting wet and providing a danger. So something similar can be extrapolated for the real life scenario. The lifeguard who's going in and doing the turnover won't have the PPE on because they're going to be wet, but the people coming in to support, who are going to be head out of the water, can have the mask on and enter the water carefully and eventually relieve the lifeguard who's without PPE from the situation as it progresses. The important thing is we don't have a protocol for every procedure the lifeguards are going to have to do. Part of their training, which they've been receiving since their bronze medallion when they first learned of the ladder approach, is risk management. And the COVID is just a new set of parameters that they're going to have to take into consideration. And with the information that they receive from the webinar that they're getting from training, is use their judgment, which is a key element of life-saving, to adapt procedures going forward.
And we have also another question regarding BVM versus pocket mask with antiviral filter. The question was, can we train our staff with BVM versus pocket mask?
So the public health recommendation is to use a pocket mask or a BVM. It doesn't put preference on one over the other. Is it possible to train your staff in BVM? The short answer is yes, but remember at the same time that we're kind of turning their world upside down a little bit by introducing a lot of new procedures, a lot of new things to think about. And if the pocket mask is considered acceptable, it is one thing that they're already comfortable with, they already do well. And just ask yourself, is it necessary to introduce the new standard and the new training when we do have an option? Going forward, the National Lifeguard Program's under revision. It's very likely that BVM is going to be introduced, so it will be a skill that lifeguards will probably have in the next couple of years. I'll leave it at that.
Thank you, Simon. I will now present you a new policy that was adopted by our board on April 24th. It was pending a future provincial policy for all sport, recreational, and outdoor federation regarding harassment and misconduct. The Life-Saving Society is committed to put forward any principle or action aimed to establish healthy, respectful, and safe environment in order to encourage harmonious relationships between its members. The aim of this policy is to establish appropriate standard of behavior to allow its member to flourish with dignity and respect. The Life-Saving Society therefore condemns all form of harassment and misconduct. This policy will apply to employees and to all members, volunteers. As an affiliate members, your instructor are members, as well as your lifeguard. And it will apply in the context of activities, for example, training, recertification, and social activities in between the member of Life-Saving Society. So I invite you to consult this policy on your affiliate member dashboard on our website. And anyone with a complaint about harassment of misconduct regarding a member of the Life-Saving Society may fill a form in line, and we will treat it with complete neutrality. You can find the form on your dashboard, and we will encourage all of our members, if they are witnesses some form of harassment of misconduct, to address these situations. Things to remember in this webinar is wash your hand. You need to have access to soap in your facility. If you don't have soap, you need to supply some hydroalcoholic solution to be sure that we may clean and disinfect our hand. Keep a distance of 2 meters in between the patrons during the intervention and the life-saving and the rescue. So you need to put a 2 meter distance to protect the batters and the staff. We don't ask the lifeguard to organize that 2 meter in between the batters, because they may some have families in the swimming pool, but we ask the patron to take their responsibility and to have 2 meters in between them. Provide appropriate PPE for intervention that will be within 2 meters. Disinfect surface and object on a regular basis. You can organize life-saving course also indoor, outdoor, and it's safe to do so. We have on the dashboard some adaptation that we promote in our class with the rescue with a 2 meter distance, and to wear some PPEs if you need to be within 2 meters. Verify with your employees if they're for the availability of the PPE, and follow the situation, because in the COVID-19 situation, the information is evolving very fast, and we were engaged at the Life-Saving Society to follow all the best practice that are in place and to communicate those to you, to be sure that you apply what's the best to prevent the transmission of COVID-19 in your facility. So, and I would like to inform also that what we presented in this webinar and all the information available from the Life-Saving Society do not replace or supersede any local or provincial public health guidance. So we ask you to refer to those guidance to the Quebec Public Health, and if the regional public health have different guidelines, we ask you to follow those guidelines. If you need more information, we have a special report on our website. You can post your question on this website, and there's a lot of information regarding life-saving course, lifeguarding, and a lot of link that will lead you to information that are important in the context of COVID-19. So I thank you for your participation today, and I wish you a warm and nice summer and a safe summer also. I hope that you will have the opportunity to share with us some pictures or information regarding how do you manage or operate your swimming pool during the COVID-19 situation. So thank you all, and thank you to all thank you to Simon, Renaud, and Eric, who presented this webinar today. So see you soon.
Thank you very much.
Merci. Mais j'ai pas une bonne nouvelle pour vous autres.
Ça n'a pas enregistré? Pourtant, c'est marqué recording.